How did napalm burns impact Vietnam or medical care? Imagine being caught in a fire that sticks to your skin, burning through every layer and causing pain like no other. That's what napalm burns did during the Vietnam War. Napalm is a sticky, flammable gel that clings to skin and clothing, making burns much worse than typical fires. When it exploded, it caused deep, full-thickness burns that often destroyed all the skin layers and underlying tissues. Victims could suffer burns that reach the 3rd degree, which means all skin and tissue are damaged. At first, these burns might seem painless because the nerve endings are destroyed, but the damage was often deadly. The burns led to severe complications like infections, massive fluid loss, and shock, making treatment very difficult. Medical teams had to act fast to save lives. They faced injuries from the burns and additional trauma from the blast effects of airstrikes. These blasts could cause internal bleeding, lung damage, and burns from inhaling superheated gases and smoke. Airway management was a top priority because swelling and inhalation injuries could block breathing and cause death. Treating napalm burns meant giving large amounts of fluids to prevent dehydration, controlling pain, and fighting infections. Surgeons had to remove dead tissue through a process called debridement and often performed skin grafts to cover the burns. These procedures required specialized skills and equipment, which were often in short supply in field hospitals. The scale of injuries from napalm overwhelmed many medical facilities. Field hospitals had to evacuate severely injured patients to better-equipped hospitals, which took time and resources. The emotional toll was also heavy. Victims' burns looked horrific and became symbols of the war's brutality. Medical staff faced not only the physical challenge of treating these injuries, but also the psychological impact of witnessing such suffering. The widespread use of napalm and its devastating effects on soldiers and civilians alike left a lasting mark on the history of medical care during the conflict. In short, napalm burns made medical treatment during the Vietnam War more complex and urgent. They required rapid, specialized care that went beyond normal battlefield injuries. The injuries caused by napalm reflected the destructive power of advanced incendiary weapons and the enormous challenge faced by medical teams trying to save lives amid chaos.